if you are a woman and you are 35 or older and you have tried to conceive for 6 months or longer, you have no periods, or you have been experiencing irregular or very painful periods, you have endometriosis or history of pelvic inflammatory disease, you have had more than one miscarriage, you have gotten cancer treatment such as chemotherapy or radiation, and if you are a man with a low number of sperm or other problems with sperm, or you have a history of testicular, prostate or sexual condition, you have a testicle that are smaller than the typical adult size, or you have swollen veins in the back of the skin that holds the testicles called the scrotum, you have had cancer treatment such as chemotherapy. Could all these be signs or factors contributing to infertility? So before we proceed, let me quickly introduce myself. Hello everyone, welcome back to today's video. I am Nurse Bola and my channel focuses on everything health and wellness. So if this is kind of content you are interested in, keep watching. In this video, I'll be talking about infertility in men and women, the signs and symptoms, the diagnosis, the test, the prevention, treatment. Infertility in men and women can result from age, hormone conditions, medical conditions, and lifestyle or environmental factors. The primary sign of infertility is the inability to conceive after a year of regular unprotected sex, or 6 months if you are over 35. Other potential signs include irregular periods, painful sex, or unexplained weight gain. So here is a more detailed breakdown of potential signs and symptoms. In women, irregular or absent period, heavy or painful periods, pelvic pain, unexplained weight loss or weight gain, hormonal imbalances, problems with ovulation, problems with fallopian tubes, problems with the uterus such as uterine fibroids, polyps or adhesions, other medical conditions such as thyroid, polycystic ovary syndrome PCOS, endometriosis, decreased sex drive, sexually transmitted infections, obesity, fertility decline. This is a condition whereby a woman's fertility starts to decline in her early 30s, and this decline accelerates after age 35. Being overweight or being underweight, egg quality and quantity. Women are born with all the eggs they will ever have, and as they age, both the quantity and the quality starts to decrease. Potential signs and symptoms of infertility in men: low sperm counts or poor sperm quality, erectile dysfunction or problems with ejaculation, testicular problems, infections, untreated STI, sexually transmitted infection. It can cause inflammation and damage to the reproductive organs, affecting fertility. Poor lifestyle habits like drinking excessive alcohol, smoking, and drug use can negatively impact sperm quality and fertility. Exposure to toxic chemicals, hormonal imbalances. Hormonal problems can affect sperm production and quality. Diagnoses include semen analysis, hormone testing, genetic testing, testicular biopsy, imaging, and other testing. You may also have physical exam that includes a check on your genitals. While tests for women include hysterosonography, hysteroscopy. You may also have a physical exam including a regular pelvic exam. Infertility tests also include ovulation testing, thyroid function test, ovarian reserve testing, hysterosalpingography, laparoscopy, imaging tests, and other hormone tests. Prevention. Some types of infertility can't be prevented, but these following tips may help you boost your chances of pregnancy. Couples have sex often after menstrual bleeding. One of the ovaries usually releases an egg in the middle of the cycle, halfway between periods. For most people with menstrual cycles about 28 days apart, it's ideal to have sex every day starting from 5 to 7 days before the release of the egg. Continue this until 2 days after ovulation. Stay away from drugs and tobacco. Don't drink a lot of alcohol. Don't take frequent baths in hot water. Stay away from pollutants and toxins. Limit medicines that may impact fertility if possible. Workout. Treatments include lifestyle changes, fertility medicines, surgery, sperm retrieval procedures, antibiotics in conditions with STI.